Hi, ladies. Happy Thursday. Happy Friday Eve. I am here again with Dr. John Thoma. You might remember him from our last video about healing plantar fasciitis through exercise. And tonight we're going to be talking about healing diastasis recti through exercise. I see this come up so often in the other mom groups I'm part of. And some of you have mentioned that you have it. Many women don't know what to do. They don't know what exercises they can and cannot do, how to heal it. Many doctors tell them that only surgery can cure it. I saw lots of moms getting suggestions for belly bands. So we're going to talk about all that tonight and get you guys some answers and some ways to take charge and heal your diastasis recti. So I'll give it to you, Dr. Thoma.
Awesome. So, first, what we'll do is we'll talk about what diastasis recti is. Diastasis recti just means basically separation of the rectus abdominis muscle. It's the very superficial muscle of the ab muscles, and there's increased risk for women who are pregnant. It can actually happen in men as well, especially if they're overweight. So, if you're overweight or you're pregnant, what ends up happening is that abdominal contents pushes out against the ab wall, which lengthens the abdominal muscles. And if you don't control it well, then what ends up happening is the very superficial muscles, the line down the six-pack muscles, what ends up happening is that separates. And if that separates too much, what can happen is the abdominal contents can herniate out, and that's probably the more extreme thing that can happen. But most of the time, when people have diastasis recti, they have back pain, and the back pain is secondary to poor ability to control the deeper ab muscles, which is internal oblique, external oblique, transverse abdominal muscles, and we'll show you guys how to activate those. And so how you can determine if you have diastasis recti is you can do it by doing a crunch. I highly recommend, if you suspect it, go to a medical professional, go to a chiro or a physical therapist or a sports medicine doctor that truly that first they look at more less invasive ways to correct the issue. But one at-home test that you can do is just basically just lay on your back and do a crunch. Hold that crunch position at the top and see if you have a like a splitting of the ab muscle. You can actually touch like the center of your ab and feel it, or in some cases you're gonna have a herniation. You'll see like a little like almost baby that just like pops out a little bit, and that is indication of diastasis recti, which is secondary
Um,
to lack of control issues of those deeper ab muscles. What's up, Hillary?
I just wanted to interject that there is a video in the group of me demoing how you can tell, like the crunch that Dr. Thoma is talking about, and how to determine if you have that space. So
Awesome.
keep going.
And then so it is a control issue. It's I don't like to say it's not really a strength issue. It's a brain to body issue, and I think it's actually more of actually a body to brain issue. It's a lack of sensory awareness, sensation of the musculature of the core going to the brain, and it could also be from a head injury. It could be as simple as like a concussion, and the integration systems of the brain are not giving that sensory information to the motor parts of the brain that tell you how to control your abs. Hillary, anything to add so far?
Well, I do. I mean, I do totally agree with that because I remember there was a woman. I didn't ever think I had it, but after we started talking about it, we determined I have a minor case of it. But I have seen a woman that I worked with. She was like so in shape, and she had it, and I was like, how could that happen if it's a strength issue? And you're right, like the mind to body. So there was like a disconnect there. It wasn't necessarily her strength. So very similar to the plantar fasciitis issue,
Exactly.
correct? Hmm.
Exactly. It's a sensory issue. We lose sensation, and that's why you don't want to use orthotics for flat feet. And it's
Yeah.
why, like, I think we talked about this at some point. We were talking about like a belt and other remedies that they have um,
Yeah.
for these for the diastasis recti.
So if anybody, I see one person's watching, comment if you have, I'm saying it wrong, diastasis recti. No, I did say it
Diastasis
right.
recti.
But comment if you do have this and if you have any questions about what you've experienced, but we'll continue moving on through, we think, what the main points are and main questions that women have.
Awesome. So the next thing that we should do is determine if you have good control of your ab muscles. And there's so many different ways to do it, but what we'll do is the probably the easiest way is just if you lie. Hey, so my screen is not that great. Do you see me?
Yeah, you're kind of far away, but just keep, yeah, I can see you.
How
Scoot
about
over a little bit. Yep,
awesome?
there you go.
So what you'll do is just lie on the floor, and what we want you to do is just contract your ab muscles. Act as if somebody was going to punch you in the stomach. What would you do? You would tighten the ab muscles up. What I want you to do is feel the muscles on the side of your abs here, not the center. Touch those and make sure that they're on. And most of the time when you touch them with your fingers, it will feel like it's actually hard and contracting. That is when we talk about feeling the ab muscles contract, it's not feeling that with our fingers because that tells us that it's actually working at least some as far as brain to body. But where the disconnect happens is when we don't use our hands and we contract our ab muscles, and you'll feel that there's just not as strong of a contraction sensation coming from one side. And I actually have a sensory issue on the right side, and it's taken me a long time to heal it. And I think it's just because I've worked out so many years and just basically build up this lack of somatic sensation in the brain. It's on my right side, so when I contract my right side, I just don't feel it with my brain, not my fingertips. I just don't feel it as well. So what you do is be sure that you can contract both of those. And if you can't, that's what you're going to work on. And then, in addition to that very simple position of just lying on your back, we need to make this more functional. That may be functional for like somebody who's like 90 years old who can't get out of bed. They're going to benefit from just lying on the ground. But most of us are going to be up, walking around, and working out. If you work out, you're going to want to do the same thing. If you're doing a press overhead, you're going to want to be sure that both obliques are on or the deep ab muscles are on. And at first, you may have to use your hand to touch to get that tactile input. But eventually, we want to just gain that sensory input from both sides. So whether I everyone's like, what do you do for core or whatever? I do train my core, but it's not by doing like crunches, and I actually don't do a ton of planks. I can't tell you the last time that I did planks. It's not bad. It's just for me, it's not what I need right now, as far as I know. But it's like anytime you do a pull up, or if you're doing good mornings, or if you're doing a deadlift, those extension. So deadlift is an extension movement. Good mornings extension movement. Those actually should be a core exercise because what you want to do is be sure that the ab muscles, the anterior core is on, and you're actually getting extension from the hips and not from so much from the low back.
Okay, can you explain that in a little bit simpler terms for someone who maybe doesn't lift that often and doesn't know what a good morning or
Can you see me?
yes.
Awesome. So we'll just do like a deadlift. So this is what a deadlift looks like. This is really an extension based exercise. What that means is I'm extending to come upright. And on this, you would think that you would be using these muscles, the back muscles, and you are going to, you should be. But what we have to do is be sure that we can create good tension in the spine by making sure that these are contracted as these are contracting as well. So it becomes an ab exercise. That's why I say like deadlifting is an ab exercise. Good morning is a great ab exercise. And what we're going to do is we're going to engage our abs and then do the extension movement. Same thing if you're doing like a shoulder press. So doing a shoulder press, be sure that the oblique is on. Whatever one doesn't work, focus on that. The other one will work, I promise you. And then just do a press, making sure that the oblique is on the whole time.
So just to recap, once someone determines that they have diastasis recti and they can determine which side is not firing, then they should do exercises like the deadlift and the good morning and the shoulder press and make sure they are flexing those ab muscles that are weak with everything they got, right?
Yeah, absolutely. And at first, I teach people to contract them pretty much with everything that they have, so then they can just develop that sensation and awareness quicker. Because if you don't contract it hard, it's going to be hard to gain that sensory pathway. And as you get better at it, you're going to notice that you don't have to have so much intention on that side oblique, whatever it is. You'll notice as you get better, and you're not going to have to contract it like you're going to like deadlift a car. It's going to be like when you go down and like just pick up a pencil from the ground. You're not going to have to contract your oblique as hard once you get into the rhythm of doing it.
So as they're working on this contraction, this will heal their. How is this going to heal them?
Yes. So what happens is you have external obliques and internal obliques that run like this, and they actually cross the center line of the ab here. And when those contract, what happens is they hold the abdominal contents in, and you don't get splitting of the rectus abdominis.
Yep. So I know that some women in this group, they don't lift weights regularly. They're not sure really how to create a routine. So I guess this shows again the importance of strength training, which I fully believe in, and I think every woman should be doing it. But if they don't have a strength training program that they're following, is there something else they can do to help this besides deadlifts and good mornings?
As you're washing dishes, make sure that your oblique is on.
Yeah.
When you bend over and you're mopping the floor, be sure that your oblique is on. And actually, whether you lift weights or not, when you're mopping the floor or you get down and you change body positions or move, you really should be contracting the ab muscles. And if you have back pain, you should be contracting them more. You got to be able to do that co-contraction or the contraction of the obliques just on command, and then eventually, hopefully, it will become reflexive for you. But if you can't create it here and feel the sensation, it's going to be super hard to develop into a reflexive pattern where you don't have to think about it until you accomplish that.
So this is really a recommendation to heal your diastasis recti is to begin strength training so you can actively contract those muscles and heal.
Yeah, strength training is by far going to be, because strength training requires more coordination and more brain output and input than it does to just like take a walk. Walking, I'm not bad at walking. Walking is awesome, but the intensity, the neurological output and input is a lot more in when you have a load on the body and you're moving several joints at one time.
Well, yeah, and walking is not going to ensure your longevity and flexibility and mobility. So that's again the the importance of strength training to ensure as you get older, you can do lots of functional movements.
Totally, totally. As we age, we lose muscle mass, we lose speed, we lose power, we lose strength. Everyone should be doing some form of strength training.
Agreed. And you had touched on it briefly, and we had discussed doing a separate video on this, but back pain. So many people have back pain, and they search out, band-aids for it, but it's the issue of their deep abdominal muscles not being strong enough, correct?
A lot of the times it is it's an issue with the deep ab muscles, and then sometimes at times it can also be control issues with the hip. It can be control issues with thoracic spine. It can be an issue with the shoulder. If you lack external rotation and you're doing something overhead and you can't get that uprightness, or the amount of shoulder flexion that you need, then what ends up happening is you will get it from the low back by overextension, and then you can also injure your back by flexion and rotation. There's so many different ways. That's why just the importance of being able to stabilize here and be able to move the extremities.
Right. I want to go back to, and let's focus a little bit more on surgery for diastasis recti. What are your thoughts on that?
Um, I'm I'm pretty much an anti-surgery guy for pretty much anything. It's not bad for everything. Please hear me out on that. I do think for diastasis recti, what you have to do is you have to exhaust the your less invasive methods, and that is somatosensation training, working with a chiro or movement, some type of movement doctor that that knows about diastasis recti. Most of them are going to know about diastasis recti. Hopefully, they can lead you on a path that will help you. If the herniation is bad enough, and you have a lifestyle where you need to use the abdominal, or you should be using the abdominal wall more, but you just keep tearing that fascia or the connective tissue that connects those two, then surgery, I guess it may be what's needed. But exhaust your least invasive methods for sure.
Absolutely. I mean, and you've definitely shown me many methods to heal injuries without surgery. So I want to reiterate. I want you to go back over the belly band thing, because I saw a lot of women suggesting that to others who have diastasis recti. What are your thoughts?
Actually, I don't even know what a belly belt is. What is it called?
Like a corset, like, a band that they're putting like a support around their stomach.
Got you. So it's an orthotic for your abs.
Yeah.
Yeah. So if you if you have a sensory issue with the obliques here, which I'm telling you, if you have diastasis recti, I almost guarantee you have sensory issues here. And if you wear something that compresses this and does the work for your brain and your body, it's not going to heal. If it's bad enough and you have to, and you're a construction worker and you have to get out there and move, maybe wearing something like that is something that you need, like while on the job. But at home and in environments where it's not as risky, highly recommend that you change that that programming from your brain into your body and then body to brain.
Okay. And then I want you to go over, in your words, exercises to avoid, because, most women are told to not do planks and sit-ups. So can you explain that further?
Yeah, I actually, exercise is not the issue. Exercise
Mm-hmm.
is not the issue. It's how you're doing exercises. I'm not a fan of crunches, but we were designed to have we were designed to do thoracic and lumbar flexion. Um, so it's not necessarily the exercise, it's how you are doing the exercises. I think that planks are actually a great way of helping with creating awareness of the ab muscles. And again, it's how you do it. You can do a plank when the lumbar spine is more in extension, and that's not going to be good.
Yeah.
So it's not so much the exercise; it's how you're doing the exercises.
So what you mean by that is if you are working on firing, that brain to muscle connection or muscle to brain connection, while you're healing the diastasis recti, you could do a plank as long as you're making sure that that side is contracted,
Yep.
correct?
Totally, totally.
Mhm.
Both sides, but most of the time, it's going to be people have an issue with just one side.
Right. Well, you're focusing on flexing the other side, but the dominant one will flex as well,
Yeah, for sure.
most likely. Okay. I haven't seen any comments or questions about this. So, is there anything you think we haven't covered, Dr. Thoma?
Actually, I was going to ask you about the notes that we talked about earlier today.
Yeah, I'm
Um,
looking at them.
uh, I feel like there's something in the middle. We covered
Mm,
we covered what it is, how you get it. Um, At the end, we covered that. It's not exercise selection really is not the issue. It's an awareness issue. Something in the middle.
no, I got your notes and I'm reading them.
We got them all.
So, yeah, but let's just recap.
Okay.
What is diastasis recti?
Diastasis recti. You have the very superficial ab muscles, the six pack muscles. What happens is they split apart like this, and the reason why they're doing that is because a lack of control of the deeper ab muscles. When we contract those, it holds the abdominal contents in, and it prevents it from protruding out that linea alba, or the very center of the rectus abdominis muscle.
Okay. And who gets it? Many women during pregnancy and some people who are overweight.
Yeah,
If
you even super fit people, just like you said earlier, you had
Mhm.
a friend who was super fit. Um, it's it just you have an increased risk if you have increased belly fat, or if you're pregnant, just because something that's on the other side of the ab muscles is pushing out against it. So what happens is all the ab muscles are going to then lengthen. So what we have to
Yeah.
do is we have to be sure that we shorten them. And then a lot of times, it's also why people have women who are pregnant, they have low back pain as well. It's because they get so much tension, they create so much tension here from doing this overextension, and then the ab muscles lengthen in the front. So not only is it their posture that overextended posture over and over and over, um, along with the um, the the um, the child that's being
A
the
fetus.
child birth. What happens is it pushes out against the ab muscles, which lengthen the ab muscles as well. So it's going to be pregnant women or anybody who's overweight, and again, anybody can get it.
Right. Well, my friend, she was pregnant, but she was fit beforehand. So that being fit does not excuse you because you've had issues too. So and then we talked about how do you know if you have it. I did a video in here about doing a crunch and feeling if you have a separation in the center of your abs. If you're concerned, please go to your doctor or a chiropractor or a physical therapist, correct, to for them to confirm.
Yeah, and I'm not knocking like a GP, a general practitioner. medical doctor, but most of them are not going to like. They're not gonna like. Most of them don't know how to handle it. It's not
No,
practice. It's not their.
they're going to tell you need surgery or you can't do anything. I'll just be honest. So, and that's not true. So, um, you talked about how you heal it is you need to find the side that you're not getting the connection to your brain and from your muscles.
Yep.
And and then really it's not really a matter of the exercises, it's a matter of making sure you have that control.
Exactly. Exactly.
So,
The I think the common theme that we're seeing here is same thing with small foot or the plantar fasciitis, the small foot. It's a control issue.
mhm.
It's a control issue in the deep abdominal musculature, and same thing that we talked about earlier too, which we can discuss later. Is it's like a scap issue as well. Shoulder issues are
Yeah.
typically a control issue.
Yeah. So really, ladies, it takes practice and consistency to make sure that you're contracting those muscles, working on it every day, every opportunity that you can when you're walking around just doing daily activities. But it's really we talked about the importance of strength training, because that's when you're going to be able to practice this the most.
Yep. If you don't strength train, what I would recommend that you do is spend at least 10 minutes per day trying to get the contractions to feel equal. And I'm telling you, they're not going to feel equal for like a long time. You're not going to correct this thing in a week. It takes time.
I mean, how would you, is it different for everybody how long it takes?
For sure, it's different for everyone. So I found mine. It's been at least 3 or 4 years ago, and I still can tell a difference when I contract here. I still feel my left one just I can feel it like so easily, and this one is like it's like 98% of what this one is. There's a
Well,
definite difference though, but early on it was an obvious difference to me. And if you can't sense that discrepancy from right to left, that's another time where I highly recommend that you find somebody to work with so they can
yeah.
guide in what you should be feeling or ways to change the output from your brain to your body so then you can actually start to feel it.
Yep. Okay. I think we covered everything.
Awesome.
So, again, ladies, if you have any questions, please post them in the comments and I can ask Dr. Thoma if I'm not able to answer them. And I'll put his information again in our group if you're in the Phoenix area and would like to visit him. He's great, and I've been seeing him for, gosh, now like 6 years or more.
Was it 6 years?
Yep.
Yeah.
All right. Well, thank you so much
Awesome.
for doing this. All right. Yes. I'll see you soon.
Awesome. Have a good night.
Okay. Bye.